Administrative Director of the O'Brien Institute, and I have the honor of moderating this panel for our talk. I think it's titled Non-Traditional Funding Sources, the Unusual Suspects, something like that. Yeah, I'm going to let our panelists introduce themselves a little bit later as part of their contributions to the discussion. Oh, by the way, our panel includes Andrea Ostergard from CSM's Office of Advancement, filling in for Sybil Choles, who's homesick today. And Andrea is with us virtually. And I've been told that us in the room won't be able to see her because of the way the hybrid is set up, but people online will be able to see her. So we'll all just imagine what Andrea looks like and her voice. Okay, so I'll start with territorial land acknowledgement. And I want to say that the land where we live, work, and play can be hard to love, I think. But with the austere prairie landscapes and sometimes the brutal weather, but I then find it's all the more gratifying and magical to find the pockets of beauty and find those moments of clement weather. So I truly am grateful to the Indigenous custodians of this land, including the people of Tree 7, which includes the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nation, the Tsuut'ina First Nation, the Stoney Nakoda, including Tiniki, Bears, Nog, and Stoney First Nations, and the city of Calgary is also home to the Métis Nation in Alberta Districts 5 and 6. So just to launch the discussion, Tri-Council operating grants are considered to be the gold standard for Canadian researchers, but there are many ways to get to Tri-Council success, and the Tri-Council open operating grants may not cover sufficiently all the kinds of work you might want to do with your research program, like knowledge translation, implementation, community engagement, training. And we know that these non-Tri-Council activities are very important for growing your research garden, from which you can then pluck the juiciest opportunities for Tri-Council or big R research. So these non-traditional opportunities, as we call them today's session, can be critical steps toward a Tri-Council grant, or maybe more importantly, consider them as ancillary opportunities to complement the non-Tri-Council aspects of your research program. So I'm going to ask our research services and advancement colleagues to start, and they're going to provide some more detail on what these non-traditional sources are and how to apply for them at UC. And then our research panelists will introduce themselves and tell us about their experiences with these funding sources. And then I've got some questions to pose to open up the discussion to all of us. So I will say, Jenna, take it away. Yeah, I don't think it matters for the.
No, you should be fine.
Although I'm a fidgeter when I sit, so if I start like moving around in front of the camera and you get to me anymore, let me know.
How do you like this?
Yeah, that would be. Oh, okay, yeah, okay, thank you. So thanks, Jamie. Thanks for inviting me to come. So my name is Jenna Slobozian. I am the manager of the Grant Development Office in the Cummings School of Medicine. So we are distinct from Research Services Office or Research Services or RSO, all of these different acronyms and names that folks call it. We are different. We focus solely on Cummings School of Medicine and supporting faculty members and postdocs here in applying for external research funding. So this is our team that I am lucky enough to work with. Clint is hiding in the back corner there. So you can send tough questions his way. Brandy, Priya, Mohit, Lori, and Vienna. So the first four folks there support faculty members in applying for anything that they're looking to apply for. So it's certainly not just CHR project grant, Tri-Council. We support applications to a whole host of different competitions and agencies. Lori, anytime you email medgrants@ucalgary.ca, it's Lori that you get that is able to answer questions and help you. And then Vienna supports our postdoctoral fellows, again, applying for whatever they might be interested in applying for, both fellowships and research grants. So I said this, but I think it's really important to kind of reiterate it, that our office in general, there's some exceptions to the rule and everybody loves exceptions. Our office supports application development for any external competitive research grant or fellowship application. And the competitive part is important. particularly when we're talking about differences between ourselves and advancement, differences between ourselves and some of the industry funding that legal would handle. It's the competitive piece there that's really important. So CSM submits about 900, just over last year, external grant applications. So you can imagine this is to, I think it's something like 500 different agencies across the gamut of the faculty, but these flow, all 900 of those flow through our office. So just a list that I pulled up in the last few months of agencies that our office has supported applications to. So the Tri-Council sort of here, ones that we think about. So the project grant, everybody talks about the project grant. We do submit about 200 applications in a year to the project grant competition. We have CHR team grants, a whole host of different opportunities there. Other operating grants that CHR also funds, catalyst grants that they fund, training grants. So there's both the health research training platforms, HRTP, which is a CHR run program, and the CREATE, which is an NSERC program. Discovery grant, which is NSERC, Alliance, NSERC, RTI, NSERC, Insight grant, Insight development grant, Connection, Partnership Engage, and Partnership Development are all SHRC programs, and Clint supports all of our SHRC funding applications. The New Frontiers and Research Fund, there's 3 different opportunities there. Some industry funded competitive applications, again, that competitive piece, kind of the important part there. And then a whole just host of other opportunities. Again, really, there's no limitation on what our office can support in terms of an agency or competition, as long as it's a competitive external grant. Some ideas about finding some of these opportunities. The first is the Research Services Office. So this is main campus. They have a funding calendar, and it is in place for both for faculty, postdoctoral fellowships, and prizes and awards. So you can just go to this one calendar. You can search for opportunities with keywords. You can also look at archived opportunities. So something may not be active right now, but may come up again in the future. Our office, one of the key things we can do is help faculty find funding opportunities. So sending us, a summary page or an idea of what you might be looking for, we can then do the hard work for you in terms of finding some funding. ResearchNet, if you're specifically looking for CHR opportunities, or there is a Tri-Council funding calendar. And so that covers all 3 of the tri-agencies, CHR, NSERC, and SHRC, so you can search there. And certainly agency mailing lists, really encourage you to be part of those. A lot of agencies now send out pre-announcements, early information about opportunities that might be coming down the pipeline. Websites and publications from others in your field. So this is a good idea. If you reading publications from others that are doing research similar to yours, they have to list their funding sources, so you can take a look at where they're being funded from as well. Yeah, I should leave it at this. What do you think, Jamie, for now?
Sure, that might be more in the
Yep, we can talk about it.
question.
Yep.
Okay, and then over to Andrea. Are you there, Andrea?
I am. I don't know if anybody can see me or if you can just hear my voice coming out from somewhere, but I'm here. Can everybody hear me okay?
Yeah.
Yeah, okay, great. Thank you so much for the opportunity to be a part of this panel today. As was mentioned at the start of the meeting, Sybil does send her regrets. She's actually quite sick and was unable to attend. So I took her place and unfortunately was unable to make it onto campus today, but happy to fill in for her part of the presentation and obviously answer any questions as well that may come up. If you could move to the next slide, please, that would be great.
My name's, oh, there we go. Little delay.
Sorry. Thank you.
We love hybrid meetings.
Okay,
We're good to go, Andrea.
Perfect. Thank you so much. So my understanding is that Sybil wanted to share a little bit about what our office does, the advancement office at the University of Calgary, and specifically within the Cummings School of Medicine. Not all that different from what Jenna mentioned is our office is located at the Foothills campus. We're just around the corner from the bookstore in the Health Sciences building. And we are part of the larger University of Calgary advancement team, but we are specifically dedicated to fundraising for priorities of the Cummings School of Medicine. We currently have a team of 6 dedicated fundraisers, as well as some additional support members of our team as well. And we fundraise for a wide range of research and education related projects and priorities throughout CSM. We do have some crossover, work that we do with Jenna's office. Some of the foundations that she listed on there, we do have some philanthropic relationships as well, and some of them are directly, as she noted, research funding as well. If you can go to the next slide, please. So where do we garner philanthropic support from? It can come from a number of different sources, corporations, foundations, individuals, sometimes what we refer to as grateful patients for those that are on the clinical side. And we also have a team of a prospect research team that helps us identify people that are interested in maybe supporting something related to the coming School of Medicine. So some of this work is proactive, where we, actively go out there, engage people, engage companies and foundations. And some of it is also through connections that come through many of you that are sitting in the room today, whether you are a clinician, whether you're out there in the community and somebody expresses interest in the work that we're doing here, in the work that you are doing. And some of it is through patients. They have been a recipient of treatment, whatever that case is, and they want to, find an opportunity to give back, to express their gratitude, and to maybe help, support future patients, down the road as well. Next slide, please. So I believe what Sybil wanted to go over in relation to specifically this talk today is where are opportunities where our office can work together with the researchers and clinicians. And it's really about how we can help you, in some cases, just recognize opportunities. If you're out there, either talking to perhaps a patient or community members and they express interest, in what we're doing here at the medical school. And it's not necessarily to train, or ask people to be fundraisers or to do things out of their comfort zone or element. It's more so just being able to recognize those opportunities and then knowing that our office is here to help support those efforts, and we can help then facilitate, those conversations and move those relationships forward. Where our office differs from research, for example, is our office will accept donations that are considered philanthropic by the University of Calgary. So we will follow Canada Revenue Agency standards. In that case, in some cases, not all, will involve tax receipting requirements or perhaps some sort of recognition. If somebody would like to create a named award or fund, things of that nature, and also to help facilitate the stewardship aspects of that. So when we receive those gifts, what happens and how do we report back to those donors to ensure them that, that the money went to where they wanted it to go towards and that the impact is being made. So some of the ways that we work with, researchers and clinicians and different, divisions and departments within CSM is, we often say, if somebody may say to you, tell me more about the research that you're doing, how can I support? And, what does that look like? If it's happened to come from a patient, they may say, we are so grateful for what you have done for me. We'd like to help more people like ourselves that are in this position. And oftentimes it's an opportunity for them to either perhaps, sometimes recognize somebody that may have passed away from that particular disease, or maybe they were, they had a successful outcome and they would just like to express, their gratitude and their appreciation for what they were able to receive and to help others as well. And so it's just a matter of, like I said, being aware of those opportunities and recognizing them, and then, knowing who to connect back with to our office so that it's not necessarily that you have to become the fundraiser, and that's where we can help facilitate all of that. So if you get questions about, how do I make a donation, tax receipting, how does all of that stuff work out? That's where, my office can provide that support and where we can work together, certainly. If we can go to the next slide, please. Oh, that may have been the last slide, or okay. I'll just wrap up quickly then, just in terms of a little bit of some of the mechanics of what happens when somebody does make a donation to the University of Calgary. Where does it go and how do we actually allocate it to specific projects, and things of that nature? So, and a very common question that we get asked from both internally and externally is, so if I make a donation to the University of Calgary, which is such a large, complex organization, where is it going to go and who determines how those funds are spent? So my office is very clear and very transparent with all of our stakeholders to ensure that if a donor says, I want to make a donation to this particular research project led by, Dr. So-and-so, we will ensure that it's going directly towards that purpose. So we will connect back to that researcher, that lead, and say, we have an incoming donation. Do you have an existing project account that we can put that fund into, or do we need to help you create a new one and ensure that those donor funds are serving the purpose that it's intended for? We have processes around establishing gift agreements, so it's all outlined for the donor. They're clear on what we're using money for, and also is for the university policies and procedures. So we understand what we can and cannot use the funds for as well. So any funds that we receive are directed very specifically. That's not to say that we also have existing sort of greatest needs funds, both for the Cummings School of Medicine generally and broadly, but for specific institutes as well, right? So O'Brien, for example, will likely have the O'Brien Institute, greatest needs funds or an impact fund, whatever they choose to call it. And that can be a little bit more broad. But when somebody wants to be very specific to support a certain, project or researcher, then we ensure that those funds are allocated accordingly. It also ensures that when the time comes, 6 months from when the donation is made, a year from then, that we can report back to the donor. And we would work specifically with the researcher and the leads in those areas to say, can we share with the donor what progress has been made, in this area as a result of their funding, and what updates can we provide in that regard. So it is a very particular process, and it's not just that people are making donations to the University of Calgary and it goes into sort of a giant pot, and somebody else gets to decide what it's used for. No, it's in consultation with the donor, the research area, or whatever the case is. And if there's opportunities to create, as I said, named awards or scholarships and whatever the case is, then, we would follow those steps accordingly as well. So I think, the purpose for this discussion and what Sybil wanted to share is our office is here to support your efforts. And, the more we know about the different aspects of research happening within each institute and whatnot, then we have a better sense of what we can go out there and talk to the community about. But also when something comes to our attention and somebody says, I have a really keen interest in this, then, we can kind of be aware to be like, oh, you know what? There is research happening in that area, led by, this team and whatnot. So the more we know, the more we can support you. And this is meant to be, establish, a partnership. So so that it's not so that you have to feel the pressure to go out and fundraise, but that we can work together, to optimize all of the opportunities that are out there. I personally have worked at the Cummings School of Medicine and fundraising office for over 8 years now, and there is tremendous interest and support in our community for what we're doing here, across the board, whether it's what the folks are doing in O'Brien, in Charbonneau, Hotchkiss Brain Institute, whatever it is. People really want to know about the depth of the things that we're doing because they see the impact that we're having, in the community. So the interest is out there, and, we just want to be able to speak to it and then to support, any interest that you may garner as well. So.
Great, thank you, Andrea. Okay, now I'm going to ask our research analysts to tell us a little bit about themselves, including their, what kind of non-traditional funding they've held before. You want to start, Joanna?
Okay, I'm Joanna Rankin, and I work in community rehab and disability studies. So yeah, when I was thinking about this, so Tiffany Bolton, who's my research partner on all the things I'm going to talk about, was going to be here today, but she's not. So, but we really struggled with traditional funding because we were trying to sort of go somewhere between research and social innovation. And we really found with the traditional funders that they didn't think our work was researchy enough. And then the more community-based funding wasn't community enough. So we found ourselves in a little bit of a hard space. So we have worked on creating what we call a radical mental health doula. So we created a framework and training and are piloting that right now. And so it sort of thinking about how we got started, we spent a lot of time meeting with people everywhere. And I think for people who are sort of getting projects started too, for us, community partnerships were like our ticket into everything. So, our first seed money was my tax grant that we got with Canadian Mental Health Association. And we sort of built those smaller things in the BPR Catalyst grant to get this going. And as we've developed into sort of bigger things, the two sort of areas that we've been really successful in is with the New Frontiers in Research Exploration Grant, which again funds research that's sort of high risk but potentially high reward, but also things that don't necessarily fit into share grants or CIHR. And everybody told us, don't bother applying for that grant, you're not gonna get it, it's too competitive, whatever, but we did, so yay. And we've just put in for the bigger one now, which again, everybody told us not everybody here, outside people. We're just like, it's too big, it's too much work, but again, I mean, for us, that really allowed us to start our project in the way that we wanted to. And our other main source of funding has been philanthropic. So again, I have never found a lot of luck in applying to calls from philanthropic organizations, but all of our community work and our community meetings kind of got on that philanthropic radar. Well, not kind of, we did get on that philanthropic radar. And so we had a philanthropic funder who funded the other half of our project, so half for New Frontiers and half to the philanthropic donor. And then we just seem to be on the radar now. So philanthropic donors call me quite regularly out of the blue, which is nice. When someone calls you and says they want to give you money. Yeah, so that's been working really well for us. And we've got actually 5, I was just counting in my head, well, everyone is talking 5 philanthropic donors that we're sort of in talks with right now. And I think in some ways you have to be very engaged with the donors in order to make that relationship work, which is hard, and like we're on committees and always, you know, going to lunches and whatever. But at the same time, I think that there is that shared relationship, and a lot of the philanthropic donors know each other, so they tell someone. And so like, I'm going to Toronto in February to meet with a group of philanthropists who would be very beneficial to us, apparently. So I think that's another way. I never thought that we would get funding, but it's actually been that's me.
Cool. Go to Gavin.
Okay, so I'm a professor in the Department of Community Health Sciences. I've been brought here because I've had a couple of examples where I've been able to access some funds at Work Tri-Council. Typically, I don't, I'm not, most of my research program is relying on Tri-Council funding, in particular CIHR. The 2 occasions over the last couple of years, or I guess 5 years, where I've drawn in funds from non-traditional sources have really been more sort of opportunistic. So I haven't really been seeking out those funding sources. They've sort of just come to me, which is quite nice. But that said, they've come to me partly through some of the partnerships and collaborations I've made along the way, where, you know, it's been sort of a coffee meeting with someone, and they've told someone else about the research that I do, and then they've passed that on and it's come back. And one of those is through a contract that we had, and actually was 3 contracts over the course of about a 4-year period with a recreation facility here in Calgary. And the other one was through the Alberta Real Estate Foundation, which might seem a bit odd given that we're in the Department of Sciences, but my research program is around the built environmental determinants of health. So that one was quite interesting because that was sort of, I was approached. They came about through a series of conversations that, you know, I was only involved with at the very beginning. And it was with a partner who then told someone else about what I was doing, and initiated the meetings with AREF. And then we got talking, and I sort of told her about the work that I was doing, and then the lines went dead for a year. And then the director of development at the time, I think it was Isabel Hogue, contacted me and said, hey, AREF wants to provide a gift to your research under these caveats. And then that started the process with that particular project. So, but then
Okay, over to Derek.
Hi, Derek Exner. So I'm a prof here as well, predominantly live in cardiovascular, but also cross employment here. So my background is cardiology, specifically heart rhythm disorders and in clinical trials. So that's sort of been my thing. The advantage of being old is you've seen it all. And the interesting thing about all this is it's changing over time, but it's not changing in a sense. So some of the perceptions change. And it's always been, you don't want to work with industry because it's dirty. They're going to take advantage of you. I can tell you for the stuff we do. So we do clinical trials upwards of $40–50 million. There's no CIHR grant that's going to cover that. So if you don't work with these other sources, you just never get your research done. I think the messaging that I've heard, which is really consistent with what we've done, is you have to be applying everywhere. You have to be very persistent. I don't know whether it's more perseverant or perseverant. They have different meanings. I would say perseverant at times. But it takes a lot of grind and a lot of going back and looking for interesting ways to fund things, such as the big trials that I'm talking about, where you're looking at one point you could, for example, get heart and stroke funding, combine it with CIHR funding, not anymore. You were able to get different sources of funding, combine it together. We've had the fortune of having a National Centers of Excellence called CanNet, and CanNet has significantly funded our research, made several $1 million to put it in perspective. So they're really important partner in that. And the other thing that I think is really important to recognize that when you use the term competitive, it's a bit misleading. So there's competitive ones where you're applying to CHR and you probably all set up panels, you know how that process is. The ones that you apply to industry are also incredibly competitive. So typically the grants that we're applying for, they're awarding 1 or 2, and there's 500 to 600 applicants. So these aren't no-brainers. These are really truly competitive things. It's a different level of competitiveness because they're looking at what's the potential market value of some of these things, what do they get out of it. I don't see that as a bad thing. That's their perception, right? They're not going to do something, even if they say it's philanthropic, it's not. There's a reason behind why they want to do some stuff. And it's, as long as you recognize that's what it is, then I'm totally fine with it. In terms of a lot of the things, so combining things like mind tax, combining partnerships with different companies, that's really what's helped fund our research. So I've been fortunate to have, Tri-Council funding for a long time now, and I use it as the main source because one of the things to be really aware of is when you go to apply for promotion, you say, I got this industry grant, they say, who cares? They want Tri-Council, they want those competitive ones because they are seen differently in terms of promotion. So don't rely fully on those, but it's a great additional source of revenue for your research program. And research is expensive, and you've got teams of people working with us. I mean, anyone who thinks that I do the research is out to lunch because I've got a team, right? And some of our teams are several hundred people, right? It's not, because you can't do this stuff with one person. So it's a very different thing in terms of clinical trials and research. So I also get, notes from people giving me money. Unfortunately, some guy from India who's, I didn't realize it's a crown prince. I just have to send him $2,000 and he could release the $4 million, but all kidding aside, those are less common for me. But I mean, it's constantly getting out. And if you want to think of it almost as advertising or business development, that doesn't come naturally to most academics. We're very conservative. We take a very, off. We don't really get involved. We don't want to promote ourselves, but when you start getting into some of the stuff, because it is a competition, all these levels, you have to do that. So those would be my 2 cents.
Nice. I just want to poke in, when you mentioned the teams and building teams in, I think it's 2 months, the next panel like this, that the Institute hosts as opposed to CHS is going to be on team building. So stay tuned for that one. And then I wanted to ask before we move on, when you said that when you are in a review and your department head or whatever is looking for the Tri-Council grants, is there also concern about conflict of interest when you work for industry?
Oh, absolutely. Yeah, I mean, so there's different ways of looking at conflict of interest. One is I'm going to avoid conflict of interest as much as I can. I'm never going to have any conflict of interest. And the other is to embrace conflict of interest and to say how can we, use this, how can we maximize it? So I mean, I look at my conflicts of interest and I've got a page of conflicts of interest. I don't know if that is a problem. I mean, I can sit on international peer review organizations. I can sit on, guidelines committees, because part of it is the people who are conflicted are probably the people who want to make the most decisions because they're involved in it at multiple levels. But other people feel very differently about it. So I think conflicts of interest are there. They need to be recognized. They need to be fully vetted. And when you start, so the other thing I do is I work with startups and including co-founding some startups, and that's where you have to be really, really careful with this stuff. Because there is a clear divide between what you're doing as a researcher at the University of Calgary and what you're doing with your own individual company. We can have a separate discussion about that. But that's not what I'm talking about today. I'm talking about as a researcher.
Yeah, because I know that's something that's come up with the agency's new, strategic plan, asking researchers to bring in so much more money that's just a natural question when it used to be, your department head would worry about,
We not only want people to bring in more money, but we want people to create innovation, we want people to create, we want people to create the new economy that we need in Alberta, which is based on.
So we don't need to be afraid of working with industry partners. There's ways to keep it all.
Yeah, but as long as you're doing it in a reasonable, legitimate way, you're going through legal, you're having those processes vetted, there's conflict of interest guidelines at the university. The School of Medicine has separate conflict of interest guidelines that we're all required to do. I mean, we're doing it legitimately, not sort of doing stuff on the side.
Nice. And now I wrote some questions that hopefully will bring the discussion out. And please point out anything I've forgotten or, jump in with anything interesting that I might have overlooked. So my first question was just, how did you find out about the non-traditional opportunities that you approached? We've heard, RSO office or OADR and fund development talk about, they try to let us know about these things. How did you in fact find out about these? We heard a little bit about it, but if you haven't already commented on that. Or if anyone out there has interesting ideas, including people online, of course.
Well, my first one was I was at a meeting and I went to a booth. And I started talking to the people at the booth and turned out it was the lead engineer from a large company, it was called Marquette, now GE Healthcare. I started talking to him and he said, wow, that's a cool question. And I said, I can answer it for you. And his eyes lit up and that was the first funding. That was a very different approach. That was, he hasn't retired yet. He just had open heart surgery last week, but, that was sort of the first one. And then I think part of it is as you start to do things, you get noticed, at least in clinical medicine.
Right.
And people say, hey, that's really interesting what you're doing. And you get approached as
Right.
many other people. I think that's the common
Yeah.
thing. It's really hard to be not known and go and get those alternate sources of funding. I think you have to either be willing to get out there and do the work, whether it's schmoozing or whether it's the grinding, sitting on committees, sitting on panels, doing it, or you just often have to have it a lot. I think we've all had training on the luck in our careers.
Was that your story too, Bonnie? Because I see you've done some stuff with the Alberta government, right? Social, whatever, department.
Yeah, those ministry, the provincial ministry calls for me, it's been immigration and labor, as well as health a little bit more recently. But yeah, it's exactly that. You meet people at events, and then you kind of the approximate topic of your work gets known, and then they've got budgets, and when they're starting to kind of think about their priorities, if there's something
You're talking about a call, not
So-
a call for applications. They called you on the phone.
I've had each.
Oh, okay.
Yeah. And so that's kind of been an interesting moment because you come into this sort of milieu and it's like, whoa, getting funding like that just seems to be the steepest mountain to climb, and it is. And then something like that happens and somebody calls you and this just kind of flips it around a little bit.
Nice. And other stories about how people first found out about their non-traditional opportunities, right?
I just wanted to say to you that I think like schmoozing is my own personal hell, but I just think, again, that doesn't come maybe naturally to many of us who sit in a room and read and write. But I found that like hitting the pavement all day, every day to get started, especially, is so important. And then our first philanthropic donation, I got a LinkedIn message, which made me think I needed to update my LinkedIn profile. But, so yeah, things, and I thought it was the prince asking for my money, but to be real. So I do just think that getting out there and making yourself known, just like you're saying, right? And then your work gets noticed.
Oh, Bill has something back.
Yeah, so, I just went that years ago was in-kind funding from an engineering company that started to develop a product or device, right? And so have you guys had any experience or is that common anymore for companies to cover the costs of building a device or?
In my research, it's a significant component of the cost. Is that in kind of?
And working with things like CFIs and stuff, it's a mainstay, but we don't, because we have so little equipment for most of what we do in delivery and going forward, it's not a big thing, but.
No, when you said schmoozing, I think it's, we don't take that as a negative term because it's outside of our comfort zone, right? We're all extroverted introverts, who just want to go to a corner, which I totally get. But you know, part of it is what I've recognized is it's connecting people. And people need to be, you need to connect at different levels. Some people, an email is sufficient, other people that need that physical contact. So I think that's a really important thing is connecting with the customers.
Yeah, you have something?
As I say, to the in-kind. So I think it might also depend on how close that funder is or the person, the group providing the funding is to the topic. So for example, with the Alberta Real Estate Foundation funding, they sort of provided the gift. It had to be relevant to their goals specifically, but they were also willing to put in staff time and work to help us recruit participants for the particular study we're doing. So in that case, they were actively involved, even though they were providing the funding, actively involved in some of the research. And actually it was similar to the other one as well, where sort of the recreational facility that was contracted us out actually had received Public Health Agency of Canada funding. And this was kind of the very first step into the kind of evaluation programs, things like that. And so they were also very much sort of side by side with us doing the research and the evaluation and providing sort of staff time, things like that into the project.
I think leveraging it is really important, right? And so there's agencies and competitions where it's a requirement, you have to have that leverage. But then there's many competitions where it's not a requirement, but it can be really important depending on the area of research that you're working in and that kind of project, right? So that buy-in, whether it's just is some staff time that they're providing as an in-kind contribution, goes a long way to show their commitment and their buy-in to that project.
And online?
How could a research trainee, postdoc, or resident take initiative with traditional sources of funding? In your experience, is this an avenue worth exploring for very early career researchers?
I just want to say in answer to that, there's so much going on in social innovation at the university now, and lots of those kind of training and things like that are for trainees, opportunities, so they can look up like social innovation, you see and find a bunch of stuff.
I would say it might depend too on how connected they are and how long they've been in the industry, the area of research they're interested in. So you know, a postdoc might have quite a few contacts and various people that they work with. And just by virtue of those contacts, the number of those contacts and the quality of those opportunities might arise in terms of some of these funding opportunities. So, I think it would be difficult without sort of maybe some guidance by a supervisor or committee to sort of form these contacts and find these opportunities.
Depending on the career stage, I mean, there's, and their intentions for the future. I mean, I think we've spent a lot of time now supporting postdocs and research associates in finding alternative sources of funding for them to transition as well to faculty members. There's a lot of opportunities for that out of the States, and we've had a lot of really great success with those.
And my comment would be find a mentor, so find someone who's done what you want to do successfully and talk to them. And particularly if it's in your subject area, because that's, if you look at almost every area, there's someone here who's done it. I mean, that's key to, I think, my success was identifying people like Brett Mitchell and George Wise, people who had done the same thing before, and I could connect with and get advice. And they're also highly connected. Now, I try to do the same for people. Same opportunity.
I would just add on to that a bit is that it's not unusual that we work with donors who want to fund things like fellowships for postdocs and early career researchers. So, certainly in medicine, that is definitely an area of interest among, philanthropic dollars to create awards such as that. And over probably the last year or so, we've really started to create some research awards or whatever you want to call it to help with what we sort of frame as, startup funding. So it can provide potentially, let's say $25,000, $50,000, which doesn't sound, large when you think about the large nature of some of these projects, but it allows them to leverage some of these bigger projects. And, to the comment that was just made, if they're working with a more, experienced, more prolific researcher, that just allows them to amplify that work as well, right? So that's not to, underscore the amount of any of those gifts, but it's not unusual that people want to create, these fellowships for postdocs, trainees, and kind of what we deem as somewhat early career, researchers and whatnot. So.
Just to follow up on that, like as postdocs that want to transition to faculty position, we are all often stuck because we're not eligible for the big grant. We have to apply with the PI, we become the PI, we write everything, and then we are co-investigator at NC. And there's also a lot of things where our contracts are short, so we cannot apply just because the ERAS deadline is after the limit of employment. So what would you, is there any mechanism? What would you?
I would suggest if you haven't already connecting with Vienna, Joanna in our office who supports our postdoctoral fellows. And then there's a lot of opportunities. I think both her and I were quite surprised as we started delving into this space of how many opportunities are potentially out there, how many research grants actually do allow postdocs to apply as a lead applicant, and how you can leverage the opportunities within the more Canadian system, which is usually where postdocs went to a lot of how you can leverage those types of opportunities for others. That are often in the States.
And I just think that it's also important, maybe to remind your supervisor to like, we have a postdoc right now and she, she's the PI on a short grant that was allowed. Like a partnership grant, not a ginormous one, but I think too, it was sort of a little bit of pushing from her towards us as well, to remember that it would be beneficial to her career. We can, be collaborators or whatever on that, but so I think sometimes we just need reminding of those things as well.
No, but I agree with, I agree with that, but I see a lot of work in UFC, for example, like the PI has to sign on the grant you want to submit and then they bounce on it. So if your PI doesn't like you wanting to do this area of research, you get something to go to as a postdoc. I'm not talking for myself, I'm talking from stories that are not just contributing to the postdocs. And I think that's first an issue where maybe your office can find ways where
we do have a new, relatively new assistant dean of research for postdoctoral researchers. So I think that's an avenue where we're trying to have some of these conversations about the roadblocks that are in place. I mean, there's reasons why a supervisor needs to sign off and a department head needs to sign off on the research being conducted, right? I mean, if the supervisor is paying that salary, they need to be aware of what that individual might be doing in their work hours and stuff like that. So there's reasons why, but there's unnecessary roadblocks as well. I don't disagree.
Yeah, because if the grant is awarded after the employment, it's a target for transition to faculty. Why would the PI say? And I so that is there's no fund right now already, anybody from goes up to final type applications. But sometimes you do independent research and you get your paper accepted and then you can't pay for it.
Oh,
and it's
yes.
sidewalk, right?
Yes.
Is there any advice on that for kind of postdoc to pay for it?
Keep the question.
Oh, the last question was about publication fees and that postdocs don't have access, don't have a lot of money to pay for publications. That is, that's been a question for a while. There used to be a UFC office and fund that you can apply to. It doesn't exist anymore. And what we
Same
tell,
question from faculty.
Yes.
It's not just postdocs that run into this problem where faculty members are.
if they
You
don't
and I
have
have
discretionary
each other once or
funds,
twice
yeah.
a year asking each other these questions. What sources are there?
Yeah.
For publication fees, it's a problem, but there is no
Yeah.
central source.
We should set up one. Right? I
We
mean,
talked about
we
that
got
too.
our philanthropic calling on the line. I mean, this
Yes.
is, no, like really, seriously, I mean, if the UFC is focused on that as a metric, That's a key performance indicator, and what's limiting you is not the quality of your work, it's not acceptance to publication, but it's the cost of publication. Seems like a
I think
no-brainer.
we've heard, like, the librarians tell us something like you could choose who you put your application into, and that there's other ways around.
You put it with the highest quality.
Yeah.
place
That's,
you can.
that's the counter argument, right? From libraries, they're like, well, you can put it into our data repository that's open access, so it meets the requirements of the funder.
Yeah.
Right? And the counter argument to that in terms of future success is it should be going into the journal.
Why does publication?
Yeah.
I'm gonna put a pin in that, and I have a whole bunch of other interesting questions. I'm just gonna ask them all to get you thinking about, do you have a story to tell or a question to ask about this? So one was, what have you learned about the appropriate fit between your project needs and the criteria of funding sources? I think that was something that Jenna's gonna go into a little bit precise. Have there been aspects of your project, things like the timing or the topic or the amount of money needed, like Derek mentioned, the desired outcomes, required partners, for example, that just couldn't be addressed with the tri-council funding? Have you ever learned the hard way that some projects just won't align with certain funders? We've heard a little bit about some of that. Then the next bunch of questions was, how did you have to adapt your usual approach to developing the application? So did you need more or different partners? Was there more or different university oversight required? Did you have to do different writing styles for different target audiences? Were there more stringent deliverables or different reporting? The next bunch of questions were, what were the benefits of approaching the non-traditional sources? Did the non-traditional award make you more or less competitive for tri-council funding? Are there any downsides? We talked a little bit about conflict of interest and things like that. Yeah, was the non-traditional source not considered valuable in your annual reporting? For example, so bunch of questions to toss out there, because I think we don't have a huge amount of time. So if there's 12:47. So anything in there bring up any
I was gonna
advice
mention,
or stories?
Derek brought this up earlier about overlap, and Heart Stroke and CHR used to be very careful about that. And something to do your homework on beforehand is overlap. Tri-agencies in general, particularly CHR, is pretty lenient. They're very, very open in terms of overlap with other projects. But some agencies are very much not. The Heart Stroke Foundation is one of those. They are very, very careful about potential overlap. So just be aware of that when you're going into opportunities. Some allow you to have that, some don't. Some it's, budgetary overlap, some it's more conceptual and methodological overlap. So just do your homework when you're thinking about other funding sources, because it can impact what you're able to do, certainly in the future.
So the answer to those questions is yes.
You've had all of those.
Yeah, I mean, I think at some point in your career, you look back and you say, yeah, that's all happened. I mean, but it's not a deterrent. You just need to be aware of it. But I mean, you'd be foolish to submit some grant to a community agency and write it the way the CHR grant is. Right? Like so I've always been told, know your audience. Don't ask for $1 million if it's a $50,000 grant. So budget appropriately.
Frame appropriately.
Frame it
right? Like,
appropriately.
if it's $1 million project, don't ask for 50,000 either, just fit in with what they're asking for, because it's not going to be easy.
But there might be a component of it. So let's say you're doing a study and you want to do a biobank component. You might be able to do that for 50,000. Will that help you at CHR? Of course, it would. You got that part funded. Because probably your last budget review, they said, take out the biobank. You say, I can take it out because I've got funding here. Because the next time you take out the biobank, they say, why is there a biobank? And it's sort of that usual process of iteration. The one big advantage of non-traditional sources is typically it doesn't have that long timeline, right? Because there's nothing more frustrating than you apply. Okay, you can apply again in a year. Well, what am I going to do for a year? So it does allow you to fill those gaps. That's something to consider as well.
I think the biggest error or issue that we see with non-traditional funding is people writing it like a CHR project grant. If that's what they're familiar with, whether it's a SURE grant or an ENSER grant, whatever they're sort of familiar with as the backbone of their research, then they're like, oh, this other opportunities come up, I'm a great fit, I've done all my homework, great, and they write the grant, and it's written for entirely the wrong audience. You think you're going to be going to a panel of experts or semi-experts that you would hopefully get on the CHR project grant. That's just not the reality. You might be writing for business people, right? We're talking about that. What do they care about? Patients. Yeah, it's a very, you might have 2 or 3 other researchers on that panel, And they could be in entirely different areas from you. So how you're writing that is very different. We see that because people will appreciate it, right? The time and effort of writing a project grant and then trying to submit it to other places as well at the same time and not just duplicating work. But it ends up in lost effort for everyone involved, with not adapting.
Yeah, the other key thing of the questions you asked was, is the level of reporting different? And the answer is incredibly different. So if you decide you want to go after federal government funding, like Prairies Can or something like that, or even if you go after some of the Alberta Innovates things like Prius grants, ACE grants, which are for innovation. I was fortunate yet unfortunate to be in the first line of Prius grants, and things changed 7 times during the 3 years in terms of reporting, which is fine, it's new. But I actually had to hire someone and I lost about $80,000 on that first grant because you couldn't go back and change your budget, even though the reporting requirements. So sometimes it's not worth applying to certain grants, and it's hard to say that, but it totally is. But the fit, if you think I'm just gonna twist this because I put a grant into CIHR, you can do that. Your success rate's probably 2%. And it may not be worth your time. And if you get it, you may wish you didn't get it because of all the reporting.
Have we
So
talked
just be aware.
Grace, I'm hardly CFI.
There's a lot of, you know,
Yeah,
US
thanks, yeah.
funding, right? Our office supports international funding. There's going to be a lot of EU funding,
Yeah.
Coming up, and I think people need to be really cognizant of that and very aware of what they're getting to potentially, right? And making sure that you're set up for that. If you just have a research team that's not set up to support that kind of funding, it may not be worth the time and effort that you're then taking from something else, right? I mean, that it's this finite number of hours in the day. And if you're taking that all away and then you're not able to focus on what's actually going on with projects and programs or that CHR grant, you do need to get in order to satisfy your department
And the
head.
teams thing, having somebody help you with the administrative once your
Absolutely.
team gets that big is so important. Has anyone ever sat on a review panel where you look at somebody's CV and say, oh, they've had funding from so-and-so, now I'm not interested? Like, is it ever a bad thing?
Looked at them and said, I'm shocked they ever got funding. No, I mean, any source of funding is. I guess if someone's, in community health sciences, and they've had all industry funded by tobacco, probably will raise some eyebrows, or, by some other source like that, I guess that would raise eyebrows, but I think for the most part, people are just, it's not necessarily the source of funding, but it's how you use that source of funding. So if I take a source of funding and I report everything's wonderful when it's intellectually not the truth, then that's gonna kill me. It's not my source of funding, that's how I approach it.
And there's no outcomes from that source.
Yeah.
Right? So there's no publications, there's no trainees that come through any of those sorts of things. Those are different.
Okay, any last,
I've got one more, yeah, so it's, no one's gonna say they're not liking receiving funding, but there's also challenges in terms of the implementation of that project or that funded project, depending on how connected you are with the funder. So, for example, in terms of one of our contracts, there was a close relationship moving forward with the project, and we had to bend a bit in terms of what we wanted to do versus what they wanted to do in their needs. And part of that was also made more difficult because of the communication. So we were kind of speaking different languages, right? So yes, all funding is great for us, but depending on the source can mean that there's different challenges. And you may not want to have to, be less flexible in your approach to research because the fund is telling you this is how it's going to be. So that's just something to consider as well.
I would say never get in a situation where the funder is going to tell you the direction of your research, if possible. I mean, sometimes you'll recognize it at the outset,
Yeah.
but if you have that spidey sense that this is not, then just say thank you, but it's not going to happen. It's just not worth it.
I just want to add one more thing too, in terms of knowing your audience and like what you're writing for. So our first philanthropic funder, they said, they told us, think big and write us a proposal. So we thought really big. And that wasn't they still gave us money, but a lot less than we thought. And then we had a call, I don't know, in December, or the board is meetings for a different philanthropic organization. The board's meeting on Thursday. This was on Tuesday. Can you send us something? So I think again, it's sort of taking your mind out of those like research grants and just writing something for a board of people who are interested in mental health in our case and innovative mental health strategies. So yeah, I think it's really important to be really flexible and take yourself out of your academic hat in many ways.
And figuring out who those people are and what they care about. Again, this is something our office can help you do. Is break down funding opportunities to say, okay, who is going to be reviewing this? What is that going to look like? What are the criterion? If it's like 60% about community engagement and you don't got any community engagement in your project, then we're probably going to tell you like, this is not worth your time, right? So you don't have to do all of that legwork yourselves. It's part of what our office is.
And something I harp on too about, was that saying that perfect is sometimes the enemy of good or whatever, that I find so many researchers, I can't possibly send this out, it's not perfect. Sometimes good enough is good enough for certain opportunities. So we're gonna wrap up at the time. Thank you so much. It's been very interesting for me hearing all of you. Thank you so much to our panelists and online. Andrea, thank you very much. And stay tuned for the upcoming panel discussion. Yeah. Good job.